It's important that people with disabilities have access to accessible communication. In this training, we are going to define the terms accessible information and effective communication, review common types of auxiliary aids and services, identify the features of accessible information and effective communication, and apply effective communication considerations to vaccine distribution operations. In this context, the terms accessible information and effective communication simply mean that there is access to receive the information is useful and relevant, and the information is as clear and understandable to people with disabilities as it is for those without disabilities. A term that is often used when discussing effective communications or emergency notifications is auxiliary aids and services. What are auxiliary aids and services? Put simply, auxiliary aids and services are devices or services that enable effective communication for people with disabilities. Local and state governments are required to provide auxiliary aids and services whenever it is needed to ensure people with disabilities have an equal opportunity to participate in and benefit from public services, programs, or activities. This requirement does not go away or become less important during times of disaster or when a public health emergency has been declared. The law does not provide for exceptions. It should be emphasized here that accessibility is not a suggestion, but a requirement. The trigger for a local health department or other public entity to provide an auxiliary aid or service is simply when a person with a disability asks for it. Health departments and other public entities are required to provide the specific type of auxiliary aid or services that the person asks for in a timely fashion and in a way that protects their privacy and independence. There are many ways that you can provide equal access to communication for people with disabilities. Some examples include the following: screen readers, computer-aided real-time transcription or CART, note takers, written materials or exchange of written notes, telephone handset amplifiers or assistive listening systems, hearing aid compatible telephones or text telephones or TTYS, speech synthesizers, communication boards or pictogram books, open or closed captioning, emails, text messaging or instant messaging, assistance filling out forms, taped text or audio recordings, braille or large print documents, video remote interpreter services, qualified readers, interpreters, or language translators. An individual with a disability may request one of a variety of auxiliary aids and services. This is especially important during an emergency or disaster because there will probably not be enough time to identify and obtain the necessary resources. Planning for and providing accessible and effective communications during day-to-day operations is necessary for your organization to do the same during times of emergency or disaster. Let's review a few common strategies for providing accessible or effective communications. Interpreting and translation services, qualified sign language interpreters, qualified readers, and video remote interpreting services. The assistant must be skilled and capable of conveying communications effectively, accurately, and impartially, and use any necessary specialized skills and vocabulary. For example, a volunteer or staff person working in a vaccine clinic may have taken 2 years of ASL in college and be able to casually converse with a person who uses ASL, but they are unlikely to be able to accurately and effectively interpret a conversation between doctor and patient that includes specific medical terms. Public entities cannot require or expect an individual with a disability to bring their own interpreter, require or expect an adult accompanying an individual with a disability to interpret for them, or require or expect a minor to interpret or facilitate communication. However, the individual with a disability can request that the accompanying adult serve as an interpreter. The only exception provided by law is in cases where there is an imminent threat to safety or welfare and no other interpreter is available, but it cannot be part of the plan. More often, public entities are choosing to provide qualified interpreters through video remote interpreting services. VRI is only an option if the following criteria are met: real-time, full-motion video with sharp delineated images, high-speed, wide bandwidth that ensures high-quality video images, clear audible transmission of voices and sound, and personnel or volunteers trained to use technology. It's important to remember that not all people who have the same type of disability will use the same type of accommodation. For example, not all individuals with a hearing disability use sign language or read lips. Not all people with a vision disability use a screen reader or magnifier, and not all people with intellectual disabilities rely on a qualified reader to fill out forms. They may opt instead to preserve their own privacy and independence and to use an assistive technology or service that meets their specific needs. For this reason, public entities should be prepared to offer multiple and redundant options for auxiliary aids and services. When you plan ahead to print and produce documents, it is easy to print or order some in alternative formats such as large print, braille, audio recordings, and documents stored electronically in accessible formats. Promoting opportunities for people with disabilities to request the specific auxiliary aid or service that best meets their needs prior to an event is a win-win for all involved. Develop accessible written information products using features like structured headings, standard fonts with clear spacing and layouts, high contrast design and color choices, non-glossy paper, and avoid use of overly complicated animation or graphics such as maps or busy pictures. If pictures are used, include alt tags. Any information provided through pictures or graphics should also be provided in an alternative plain text accessible format. Large print documents improve the accessibility and readability for many people with various disabilities. Key features of large print documents include 16-point or 18-point font, black and white print, wide spacing between letters, and bold or heavy fonts for emphasis instead of italics and uppercase letters. Public information and disaster alerts and warnings use the internet, websites, and apps much more than any other strategy. This makes it critical for all electronic sites and communication to meet accessibility standards to ensure effective and accessible communication for people with disabilities. Since many people with disabilities do not have access to the internet, it is also critical for health departments not to rely exclusively on electronic communication, but to plan face-to-face, networking, written communication, and other low-technology approaches. We are not only concerned with how information is delivered, but also what information is delivered. Health and public health information needs to be culturally appropriate, meaningful, and useful. This can be accomplished through giving information that tells people what to do, using plain language that is easily understood, avoiding using acronyms and health or medical terminology, and using people-first language that people can relate to. People-first language describes a person by what they do or need rather than a label of what the person is. It prioritizes and focuses on the individual rather than their disability. After all, a disability is only one part of the many characteristics that make up a person. Let's consider an example related to a community COVID-19 vaccination program. COVID-19 and vaccination-related information that should be accessible to the whole community includes information about vaccine priority groups, location and time of vaccine clinics, vaccine registration process, vaccine safety information, health or identifying documents to bring, support services available such as transportation assistance, at-home or mobile services, how to request accommodations for a disability, and how to obtain additional information from local public health officials. Tips for providing accessible information at a vaccine distribution site. Videos that show the proper way to wear a mask, wash hands, or maintain social distancing should also include closed captions, transcripts, and ASL interpretation, as well as how to do these activities with a disability. Maps of vaccination clinics should be accompanied by an accessible document that lists out the vaccine locations and addresses. Accessible entrances and routes should also be visible on the map. Mobile, at-home, and other vaccination options should be clearly visible and easy to find and include clear instructions on how to request or access these services. Social media posts that promote vaccination should be accessible and inclusive and use plain language. Electronic versions of registration or consent forms should be available before people arrive. JIT training for staff and volunteers on providing effective communications, an example VRI, ASL, or Braille. Post clear and easy-to-read navigational signage using images or graphics whenever possible. Implement a process to routinely check accessibility of all information being provided. This may involve staff or volunteers with disabilities conducting a walkthrough and trial. Consult and partner with people with disability and disability-led organizations. It is a best practice for ensuring the development and dissemination of accessible and inclusive information. This video reviewed some important considerations for accessible and effective communications that can impact the experiences of people with a disability in a disaster. This video was provided by the Royal Institute on Disability, Thanks to the Center of Disease Control Foundation. Thank you for watching.